Hi, good afternoon. I think we're right at the top of the hour, so we'll go ahead and get started. Thank you everyone for joining us for today's webinar. I am Rachel DePaul. I'm the Senior Director of Programs at the National Kidney Foundation of Illinois, and I'm very pleased to welcome you today. So the NKFI mission is to improve the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. We also do have a professional advisory board. So if you're interested in joining, any professional working in a nephrology field is welcome to join. And we do provide several benefits through the professional advisory board. Also, our new innovations grant, the application is due on December 31st. It's a new grant funding up to $30,000 to help support an innovative idea and caring for those at risk for kidney disease. We also have a brand new podcast called The Journey Continues. It's committed to promoting powerful stories of kidney patients, living donors, transplant recipients, donor families, and industry experts. You can find that anywhere that you listen to podcasts. It comes out 2 times per month. And if you need any more information, please visit our website at www.nkfi.org. So at this time, I'm very pleased to turn it over to Megan and Elida, who will be presenting today's main presentation.
Good morning, everyone. My name is Megan Forstall. I'm a public affairs specialist for Social Security. I cover about 17 offices in northern and north central Illinois, including a lot of the Chicago suburban offices. And I'm joined by my colleague, Elida. Elida, do you want to introduce yourself? Take out your mute off.
Hello, my name is Elida Elizondo, and I'm also a public affairs specialist with the Social Security Administration, and I cover the offices in Wisconsin.
So today, Elida and I want to go through some information with you and provide a little bit of an overview of our disability program, as well as getting specific into our end-stage renal disease coverage and how that affects our Medicare coverage. At Social Security, we want you to know we are with you throughout life's journey, and that includes if somebody should become disabled. So first of all, I want to explain what our definition of a disability is. For adults, what we're looking at is somebody who cannot work due to a severe medical impairment that's expected to last at least a year or result in death. So someone does not have to have already been off work for a year to apply for disability, but we're looking at long-term disability. So the anticipation is it's going to continue to keep them out of work for at least a year, or if they're working, it's preventing substantial work. Now, substantial gainful employment, that's actually a dollar figure every year. So for this year in 2020, we're looking at whether a person can work and make up to $1,260 gross a month. Or for 2021, that's going up to $1,310 gross a month. So again, we do have a pretty specific and kind of tight definition of a disability. It's a little more restrictive than maybe through the Veterans Affairs or other different services might use for a definition of disability. We have 2 different programs that we administer based on disability. One is Social Security disability. That's what we're going to talk about first. And then we also have a needs-based program called Supplemental Security Income. So for Social Security disability, someone has to have worked in not just most recently enough, but also an overall amount of time paying into those FICA taxes. So basically, when you're filing for a disability, it's almost like getting your retirement benefit early. It's coming from the insurance program that you work and pay into with FICA taxes. So in generally, this is the amount of recent work you need to be considered disabled or be qualified, for Social Security disability. So for younger individuals, of course, they need less work. Generally about a year and a half out of the last 3 years of work before becoming disabled. As a person gets older, they need more work, of course, between 24 and 31. Someone has to have worked about half of that time to be considered eligible for Social Security disability. So insured is what we call it for the program. And then somebody who is 31 or later or older, they have to have worked 5 of the last 10 years before becoming disabled. So occasionally we do have individuals who maybe have severe medical impairments. However, they had stopped work or had reduced work previously for reasons other than a disability. So at that point, they might not have enough recent work for Social Security disability. Now, someone can see, and we'll talk about it toward the end, if they're insured for Social Security disability in their My Social Security account. So there is a way to determine if they're eligible for Social Security disability without having to call the local office or call our national number. Now, our other program we have is supplemental security income. This is a completely different set of eligibility to receive SSI. So someone could have never worked and paid into the system and still qualify for SSI. The actual definition of the disability, as far as being able to work substantial gainful activity and having it 12 months or longer, those are the same for both programs, but otherwise the eligibility rules for SSI versus Social Security are completely different. For SSI, what we're looking at is somebody must have very limited income and resources and then meet that definition of a disability, or we do have SSI for individuals who are 65 years of age or older, or we have specific rules for blindness for each, and blindness and visual impairment for each program. With SSI, there are also potentially benefits for children with disabilities, whereas Social Security is for somebody who has worked and paid into it. And so usually is an adult or, older teenager. Some things we look at for SSI, we look at basically all income and resources. So these are just some more common things we look at from SSI. When we do an application for SSI, it's a very comprehensive list. Excuse me one moment, please. I apologize. My dog knew I was doing something important. So for SSI, with income, just some of the more common things we look at for earned income is wages, net earnings from self-employment, or payments from sheltered workshops. Unearned income, again, these are just the most common forms, but we do look at everything. Might be Social Security benefits, veterans benefits, unemployment, interest, pensions, or even cash that family and friends are giving the individual. Resources, again, just kind of some more common ones. We do have a $2,000 limit for an individual that's filing, a $3,000 limit if it is an individual who's living with their spouse. For some things that we can exclude for resources from the $2,000 limit is a home in which someone lives, one car. Generally, we can exclude the highest valued vehicle as long as it is used for transportation, and burial plots for the individual and other family members, and sometimes some certain resources set aside for burial can be excluded. And then basically, for the most part, everything else is counted, although we always run into situations where we have to refer to policy because there's exceptions to almost every rule, it seems. But some general, most common resources would be like bank accounts, IRAs, stocks, bonds, 401ks. Now, if somebody is applying and their spouse is living in the household, we can usually exclude their spouse's 401k through an employer. But if it's the individual's own 401k, we're going to look at that. An extra second car, life insurance, or property other than where someone lives. And then another thing we're looking at SSI to determine what we can pay an individual is their living arrangement. And so that can affect how much of a monthly check someone could be due on SSI. If they're living in someone else's household and not paying their fair share of bills, they're going to get a reduced payment. If they're in the nursing home or other institution that Medicaid is paying more than 50%, then they're only eligible for $30 a month with SSI. And then we have specific policies for individuals in group care or board and care facility where we have to evaluate the facility and determine what payment they can be eligible for. Now, someone should apply for disability benefits as soon as they become disabled. As I mentioned, you don't want to wait to be off work for a year when considering disability, but again, it should be looking to be a long-term disability. So if someone, breaks their arm and is expected to be back at work in 6 to 8 weeks, then they're likely going to probably not want to file for disability unless it turns into something more long-term. But otherwise, the application should be done as soon as someone becomes disabled. This says application to take 3 to 5 months. I would say in Illinois, we're running probably more than 4 to 6 months. Sometimes we are able to make that application process faster if we have all the information needed and certain conditions get flagged for faster decisions. As far as how to apply for disability benefits, that can be done online through our socialsecurity.gov website, /disability, or we'll show you toward the end on the main page, there's a disability panel you can click on, or by calling to make an appointment at a local office through our toll-free number at 1-800-772-1213. Now, the majority of our business is being done over the phone right now, but if someone's not able to file online, they can get an appointment to talk to somebody via the phone for that application from their local office. Now, as far as SSI, that can also be done online sometimes, not always, but a large part of the application can be done either way as far as the medical and doctor's information, and then under certain circumstances, the actual SSI application can be done online as well. If you're not able to do the SSI application, you're helping somebody that's not able to do the SSI application online, as long as they do the Social Security disability application and indicate they want to file for SSI, someone will recontact them to complete that SSI application. Once we have reviewed eligibility for the Social Security disability program, the SSI program at the office, all we're doing locally is making sure whether a person meets either that work requirements, the recent and overall work requirement, or the income and resource requirement, or if they meet both, we'll send both down for a decision for SSI and Social Security. Then what we're going to do is send it to our disability termination service. So in Illinois, that's located in Springfield, and the actual medical decision is made by the adjudicator in Springfield that makes that decision. What they're going to do is they're going to review all the medical evidence. Sometimes they will ask somebody to go see a Social Security doctor that we're contracting with to compare what their thoughts are with the specialist the person sees, or sometimes somebody might file and they haven't been to a doctor in 5 or 10 years, and then we definitely need a recent evaluation from one of our contracted doctors that we work with. But they're also going to use any medical evidence from the doctors and hospitals that the person lists in their application. So it's really important when someone is completing their disability report that they make sure to list the most relevant doctors and hospitals they've seen, so that we can make sure to get all the evidence and medical records for a decision. And then once a decision is made by that disability termination service, it kind of depends on which programs are being filed for. If it's Social Security disability, you generally get a letter right away either way. It'll either be an award letter, letting you know how much, the check will be and reporting responsibilities, things like that. If it's a denial, it'll explain why the denial was made and explain how to appeal in a decision. And for SSI, we usually have to recontact the person to go back through the update of income, resources, and living arrangements before we can start the payment. So in that case, they'll either receive a call from the local office or a letter to call into the local office to make sure that that application gets updated. If approved, if denied, again, they'll receive the decision as to why it was denied. Now I'm going to turn it over to Alita to talk about Medicare and Medicaid.
Okay, so Medicare is a federal health insurance, and this is for people who are 65 or older, or people who have been getting disability benefits for 24 consecutive months. So this is 24 months after your month of entitlement to disability, we automatically give you the Medicare. Medicaid, that's a state health program for people with low income and limited resources. So in most states, children who get SSI and adults will qualify for the Medicaid. And I understand in the state of Illinois, it's there are some states that the Medicaid is automatic with the SSI eligibility, but in Illinois, it is not. In Wisconsin, it is automatic. In Illinois, you would have to file for that separately through the state office. Next. Okay, so for Medicare eligibility, so most people who become eligible for Medicare will become eligible at age 65. If you are already receiving Social Security benefits, Social Security disability, or retirement, at age 65, you will automatically receive the Medicare card, and you don't need to do anything if you want to keep the Medicare Part A and B. The other way is when a person has been disabled for 24 months and has been getting benefits, we also give them the Medicare automatically. Again, there is nothing to do if you want to keep the Medicare. If you do not want the Medicare to start, the Part B, then you will need to contact us and let us know that you don't want the Part B. There is no premium for Part A, so you want to keep the Part A. The other people who become eligible for the Medicare is that somebody with ALS or Lou Gehrig's disease. They can become eligible for Medicare. People who have kidney failure, the end-stage renal disease. We also give Medicare to people who have been exposed to an environmental health hazard. And then there's different enrollment periods, which I'll go over that right now. Next. So Medicare consists of Part A, which is the hospital insurance, Part B, which is the medical insurance, and this would cover any outpatient hospital procedures. And then for the original Medicare, you can add the prescription drug plan. And then you can also add a supplemental insurance to cover the gap, because Medicare pays 80% of the amount. The Medicare Advantage, which is also known as Part C, that also includes Part A and B. Most plans also include the Part D with this Advantage plan, and they may also include extra benefits such as vision, hearing, dental, and many other things. The difference between these two plans is the out-of-pocket costs are usually lower with the Medicare Advantage, but you are limited to which doctors, hospitals, and clinics you can go to. So with the original Medicare, you can use it anywhere in the US that accepts Medicare. The Medicare Advantage plans, it's usually in an area, where you live, and you can't use it all over the country. So you want to make sure that you understand the difference between the original Medicare and the Medicare Advantage. Next. Social Security's ESRD definition. So our definition of the end-stage renal disease is that a person has irreversible damage to an individual's kidneys so severely affecting his or her ability to remove or adjust blood waste that to maintain life, the person must have either a regular course of dialysis or a kidney transplant. Next. So this is the form, the 2728, that we need to start the process to enroll somebody in the end-stage renal Medicare. It's very important that we get the two forms, the 2728, the form explaining the dates and everything for the Medicare. We also need the CMS 43, which is the actual application. But sometimes we receive the 2728, and we will try to contact the person the proper applicant to complete the application. Sometimes we receive only the CMS 43, which is the application, and then we have to contact the stage renal facility to get the 2728. So we want to stress, in order to enroll somebody, we need both of these forms. And it's very important that we try to get these forms to come into our office together. If we end up trying to reach the person and we're unable to reach the person, then we're going to send out a 6-month closeout notice and they'll be protected from the date that we receive the 2728. And then we're still not going to be able to process the end-stage renal until we get both. So it's very important that both of these forms come in together so that we can get things started quickly. Next. So this is a website where the forms are available, 2728 and the actual application for the end-stage renal. Megan, are you going to show us how to get this? Okay.
Sorry, I got to get the right, I had it open, so let me get the right screen here. Go. Okay. Okay. Can you see our actual website now?
Yeah.
So you can use the search box to find both of the forms that we need if you don't have copies on hand. But we just wanted to show you the CMS 43. When you go in here, it's a little finicky. It'll ask you to do a zip drive, and then when you click on that, you open and you'll need to go to the second one, and it'll show you then that application that we need completed. And same thing for the 2728. Really easy to access on cms.gov and then the search box. And that one's a PDF, so that one's even more user-friendly.
Mm-hmm. Right. So this is where you're going to go to get the forms. And it's a good idea to go here because this way you know that you have the latest version. You have the latest one that's available. Whereas if you keep a copy, it's probably the right one, but it may be an older version. Okay. Next. Okay, so what are the requirements for entitlement to the end-stage renal Medicare? So in order to be entitled to this Medicare because of end-stage renal, the individual has to meet the insured status. Just like for retirement benefits, you have to have worked long enough and be insured on the first day of the month of the transplant or when the regular dialysis is required. If a person has not worked long enough because for whatever reason they're not insured, they could receive the Medicare through a spouse who's insured, or a dependent child of an individual could also receive entitlement through their parents who are currently insured. Once we determine that a person is insured either on their own or through parents or their children, they can file an application for Medicare. The 2728 is the actual application, or no, the 2728 is not an actual application. That's where I said if we receive it, we're still going to need to contact the individual to get the application for the Medicare, either on the phone or the actual paper form itself. Next. So the dates of entitlement for the Medicare High. So the entitlement for the Medicare High is the earliest of the following. The third month after the month of a regular course of dialysis. So there's a waiting period. If I start dialysis today in December, then the waiting period is January, February, and my Medicare would start in the month of March. Or the first month of a regular course of dialysis begins if the individual begins self-dialysis training. So if the individual is doing the self-dialysis, then they could be entitled the first month of the regular course of dialysis. Or the month of a kidney transplant. The month in inpatient Medicare approved facility. So the day that the person goes into a Medicare approved facility to start the preliminary process for the transplant, they can get the Medicare provided that the transplant occurs within 2 months. Or if it doesn't occur within 2 months, then they would get the Medicare the second month prior to the month of the kidney transplant. Or the first month, a period of regular dialysis resumes if the individual had it before. So somebody who's already been on the Medicare and has already had a waiting period, then we would waive it for them. Next. And then the dates of entitlement for the SMI. So once a person is entitled to the hospital, then they can also be entitled to the SMI, which is the medical. So if they have not refused the medical, it would start the first month of entitlement to the hospital insurance. Or if there's more than 6 months of arrearage, they can decide to take the SMI part, either the month of enrollment or the month of filing, so that they don't have to pay all the months of arrearage. Next. So some people who are eligible for the end-stage renal Medicare have group health insurance. So they may have group health insurance either through their own work, spouse's work, or a parent's work. And it's very important that these people understand about the 30-month coordination period with Medicare, because there are advantages and disadvantages to filing when they become entitled or delaying the process because of this coverage through the group health plan. Okay, so what are the disadvantages of filing with the group health plan? Okay, so one thing that we talk about, we discuss with somebody who has the group health plan coverage is that because during this 30-month period, Medicare is secondary and the group health plan is primary. So we need them to understand that if they do not take the Medicare at that time, there's no special enrollment periods for supplemental insurance. So they must either file when they're eligible and pay the premiums, or file during the general enrollment period and possibly pay a premium surcharge. If they take the hospital insurance and delay the SMI, the transplant would be covered, but any immunosuppressive drugs would not be. Next. And then the advantages of filing with the group health plan is what we tell somebody is they need to figure out what their out-of-pocket expenses are going to be after the group health plan pays their portion. Because if the amount that they will be having to pay out of pocket is more than the premium amount for the end-stage renal Medicare, then they're probably better off taking it. But if it's going to be less, their out-of-pocket is less than the premium amount, then they're going to be paying 2 premiums, the premium from their group insurance and the premium through Medicare, and it may not be beneficial for them. So that's what they have to look at, whether it's more or less, the premium is more or less than their out-of-pocket expenses. And or the other disadvantage is that he or she may already be close to the 30-month coordination period by the time of filing. So or the group health may be ending soon. So you have to take into account that if your 30-month period is almost over, then you want to get on the Medicare. And if your group health is ending soon, you also want to make sure that you get on. Next. Okay, so this is the Medicare.gov website. Social Security, what we do with Medicare is the enrollment. We will enroll you, we'll take the application, we'll process the enrollment for Medicare. Social Security also takes care of collecting the premium. That's about it. Everything else, CMS doesn't, and this is the website that they have set up. This is where you would go to find out information on your what's covered, what's not covered, your claims, your appeals, anything having to do with the coverage and what's been paid and hasn't been paid. You're going to want to go to the Medicare.gov website. Medicare doesn't have an office, so a lot of times people will ask us, oh, well, where's my nearest Medicare office? There is no Medicare office. The way you reach them is through the website, medicare.gov, or 1-800-MEDICARE. That's the way to reach Medicare. Next.
So I'm going to take over and talk to you about our website, socialsecurity.gov, which we've mentioned a few times already. We really are proud of our website, and we encourage everyone to please take a look at it, not just for your job, but also for yourself. There's a lot of great features here. One thing to draw attention to is that we do have a coronavirus COVID-19 update page. So that at the very top, you can see that orange bar. If you were live on the website and you click on that, you can subscribe to get alerted when we have any updates for changes in service, policy changes, things like that related to COVID-19. Then you can see the large panels. This main panel will change from time to time, depending on what the most hot topic, relevant topic is. So when we had our cost of living released, then you could find that information easily right there. A lot of times it is this coronavirus impact statement. And then the panels generally stay the same for the other four as far as highlighting our online services. Our retirement panel would be where you can go in to click in to do some more planning or file for retirement benefits. Medicare enrollment, a lot of great features there. Not only can you initially apply for Medicare, but you can submit paperwork for a special enrollment period if you had previously refused it and due to employer group health coverage, get more information on Medicare. And then disability, like I said earlier, you can go directly to that socialsecurity.gov/disability, or you can find all the information right here and the link to the application on our main page. Some other things to look at include our frequently asked questions. So you might think of some questions after we're done today. Of course, you can always call our toll-free number or your local office, but it might be a question we've already answered in this section. So it's a good tool to check out. And then I'll talk about our My Social Security accounts in a little bit. Under the menu tab, we have information for different groups. We have one of the menu tabs is related to like healthcare providers that gives you information should you receive forms and related to disability claims or things like that. Our My Social Security accounts, we actually encourage everyone over the age of 18 to create a My Social Security account. A lot of great features for you, even if you're not on benefits. And those My Social Security accounts, you can create one on your phone, tablet, laptop, any source. So to create an account, you're just going to go onto the My Social Security account. Then once you have your account created, you're going to have a username and password you've created. And every time that you log in, you're going to be asked for a security code. So this is a very secure site. You're going to get that via text message or email, whichever you choose when you first establish it. Personally, I think text message is the easiest as long as you don't have to pay per text message. So even if once you're on benefits, there's a lot of things you can do on these My Social Security accounts, such as let us know how you want your notices, report wages if on disability or SSI, get a benefit verification letter. And this is a really big one because we get a lot of requests. People will say, they'll call it an award letter or proof of income, and they need these letters for lots of different services. So those can be printed right online rather than having to wait for them to come in the mail. Change address, phone number, bank account. If on Medicare, getting requested to do a Medicare card, got a doctor's appointment that day, you can print proof of the Medicare and get a replacement 1099 at tax season. But even if not on benefits, there's a lot of reasons we want everyone to create one of these accounts. We have a great retirement calculator on there that you can go around and play with different scenarios when you're planning your own retirement. Maybe you want to see your estimates at different points between 62 and 70, and you want to be able to select different dates for when you're going to receive it, or maybe you want to play around with adjusting your income for different years and see how that affects things. A big one, right, especially right now, if you have in Illinois, if you have a valid driver's license or state ID, you can request a replacement Social Security card online. So this would be as long as you're not updating citizenship, name, like for marriage, things like that. It's just a straight up replacement card. You can generally get that done online. So we are open for very limited in-person services right now. Replacement Social Security cards are generally not one of those services that we can have you come in for, which means people are having to mail in their driver's license or state ID, when in reality, if they get the My Social Security account set up, can just request the card that way. If someone's currently applying, check the status of an application. And then we really want you to log in to get those estimates for planning, but also to make sure your earnings are posted correctly. So once a year, you just get an email that reminds you to log in, make sure those look correct, because it's much easier to catch a missing earnings year from 2-3 years ago and get that, W-2 to us and get that posted than if you wait and when you file for retirement, we say, oh, well, do you know what happened in 1992? We don't have any earnings. And you're like, well, it might be hard for me to find proof of that at this point. So we used to send the forms out in the mail every year. We do send a form out close to retirement, but not regularly anymore. So that's why you want to go ahead and create one of these accounts. Just another great reason too. And then before we go, I want to touch on scam calls. So you've probably received one yourself, maybe, or you've talked to a relative or friend that's received one. Social Security has been a big target of these scammers for over a year now. It's been a problem. And we really have tried to do a lot of campaigns to provide awareness, but unfortunately, people are still falling victim to these. So anytime you can be aware of them yourself and help us share the message with your friends, family, clients you work with, this would be great to help out and make sure that people know that we are not going to call from Social Security and threaten you or say we'll suspend a Social Security number. Of course, we'll never demand immediate payment via cash, prepaid gift cards, wire transfers, anything like that. So we just want people to know to hang up on those calls, do not give any money or personal information. And then if someone has time, if you receive a scam call or talking to someone who has, it's always great to report the scam to our oig.ssa.gov page. It just kind of helps them try to track. They have managed to catch some of these scammers by the information provided by the public to them and being able to locate where some of these calls are originating from. And then we do have several different social media outlets. So we have a Facebook page, a Twitter, an Instagram, a LinkedIn, and we have a YouTube page that has some great how-to videos like how to create a My Social Security account, our PSAs on scam awareness, all those great sources on our YouTube page. So we encourage you to follow us on social media, share the information with friends and family. So as Alita mentioned, she's out of Wisconsin, and that is her email address. So I know most of the people are in Illinois here, but if you have a colleague from Wisconsin too that might need assistance, then she can take care of them. Or if I'm not available and you're in need of something, say you get my out of office reply, then you can always go to Alita for assistance. We work under the same area, so that's why we're working together today. And my email address is on there. Alita and I are both covering a lot of offices though, so if we can't get back to you right away, start with the local office, usually with a case specific question. If you cannot get the answer you need from them or not getting help quickly enough, then please let us know. Or if you have general questions, please always let us know. Email is an easy way for us to respond to you quickly. And if you want to work with the local office, we have a great field office locator tool at the link there listed on our page. The contact us gives you the different email or options to contact. That office locator is where you can put in the zip code, and it'll give you the local office phone number, address, fax number, if you're needing to fax any paperwork to them. All of that will be available on that contact us section.
Okay.
And that's it for our presentation today. Thanks for joining us, and we're available for any questions you have as well.
And this is Rachel. If you do have any questions, please feel free to use the Q&A or the chat buttons at the bottom of your screen to type in your questions. Okay, I'm not seeing any questions come in, so I think that I'll just say thank you both so much for presenting today. We really appreciate your time and having you join us, and thank you everyone who attended as well. I will try and have a recording available within the next few days in case anybody wants to come back and watch any of the content, but thank you all.
Thank you.
Thank you.